Hi everyone! The first thing I want to say regarding next week's respiratory system exam is that we will be taking a paper exam back in our normal classroom, Chem Sci 101, same time, 3 o'clock, but not in the same place we have been. I know some of you will be pretty happy about this. We actually can't take our exam in the computer lab because it's booked. So just remember that next week we're going back to our classroom just like we did at the beginning of the year. Secondly, we're going to do a couple things different about this exam, and I'm going to get to the big changes, but I do have a handout here for you to look at for some of the things that you can expect to see. I'm going to change up how we're doing the pathology and diagnostics and that kind of stuff, and you'll see that as we go through this. So, first off on this exam, there's no labeling, so you don't have to label parts of the respiratory system or anything along those lines. Also, there's a table in the book, 7.2. You don't have to know that one. There's another one, 7.1, which I will expect you to know, and you'll see that, but I'll get to that in a minute. One of the things you can expect a few different questions on is right here, the pathway of air. If you remember how we did that for the cardiovascular system, I'm going to do something very similar to that for the respiratory system. So just briefly, air enters your body through the nose and it gets into the nasal cavity, and then it's going to go through the three parts of the pharynx, which is the nasopharynx, the oropharynx connected to your mouth, and the laryngopharynx, through the glottis, which is the opening into the trachea, splits down to your left and right primary bronchi. Those are the first two splits from the trachea down into the lungs. They're very big. Then the primary bronchi split off into multiple secondary bronchi. Then those split off into tertiary bronchi, and then those split into bronchioles. So after that, you have respiratory bronchioles, and the difference between the two is that respiratory bronchioles actually have alveoli on them, whereas just a regular bronchiole doesn't. So that's an important fact to know. After the respiratory bronchioles, you have the alveolar ducts and then the alveoli. So know that pathway, look at the pictures, it's very helpful, it'll help keep everything straight. It's an important thing to know. You do not need to know anything about the tonsils. You should know the membranes on the lungs. We've talked about them before, the visceral and parietal pleura, or parietal pleura, however you want to say that. Now, down here, we have lung volumes and capacities. And this chart is very handy because I do want you to know the lung volumes and capacities. And the difference between the two is that a volume is a single measurement of air, whereas a capacity is a combination of different volumes. So your tidal volume is just, normal in and out, but your total lung capacity is your tidal volume plus this, plus that, plus that. So capacities are always additions of more than one volume. You need to know the definitions for the different volumes, but you don't actually have to know the values. So how much is in this volume, that kind of thing. This chart can help you, but you don't have to know it. So just a few simple definitions regarding the volumes. Your tidal volume is the volume of air that moves in and out when you take just a normal breath. So breathing in totally normally, not forcefully in any direction. Inspiratory reserve volume is the maximum inhale that you can take after you take a normal breath in. So you breathe in and then big breath. That volume that you hold there is the inspiratory reserve volume, and you can see it right here. This distance is the inspiratory reserve volume. Expiratory reserve volume is just like inspiratory, but it's breathing out. So expiratory reserve is after you exhale out normally, you breathe out even more. That's your expiratory reserve. So it's kind of tricky, and maybe doing these breathing things, it might seem silly, might help you remember what they are. So residual volume, or RV here, is what's left in your lungs after you exhale out everything you can. There's always a little bit of air left in your lungs. If there wasn't, if you could exhale it all out, the lungs would just constantly be collapsing, and that would be bad. So you have the residual volume, which is right here. And you can kind of see it's quite a bit. There's actually a lot. Plus, we want that residual volume down there in order to allow gas exchange to happen, even if we're not actually exhaling or inhaling, inspiring or expiring, I guess I could say. So the capacities then, as I said, are just the volumes added together. Your inspiratory capacity is a normal breath in plus your maximum inhale. So your tidal volume, which is a normal breath in, and your inspiratory reserve. You can see here, here's that inspiratory capacity taking into fact that tidal volume and inspiratory reserve volume. Functional residual capacity is the air in the lungs after a normal exhale. So it's your expiratory reserve plus the residual volume. So you breathe out, just normal exhale, and then everything that's left, including residual volume, is your functional residual capacity. Vital capacity is your maximum inhalation, maximum exhalation. That all added together is vital capacity, and you can kind of see right here what that is. And then total lung capacity is your vital capacity with the residual volume added in. So, this is my cat Lewis. He apparently can't stay out of the way. Sorry about that. But all the air that your lungs can hold, residual, expiratory reserve, tidal volume, inspiratory reserve, that all equals your total lung capacity. Now, like I said, we're going to do something a little bit different for the pathology. And so what I'm going to do is I'm going to switch to a Google document that I made that I want to talk to you about, and I want you to think about trying our exam this way. All right, what you have in front of you here is a Google Doc which I will give you access to through Canvas. And it's basically going to be a list that you guys create of the pathology, diagnostic procedures, therapeutic procedures, and pharmacology that we are going to put on this exam. So it's overwhelming. There's always a lot of stuff to know. I'm going to give you a little break this time. I can't say this is going to happen every time, but we're going to see how it goes and how we do. And what I would like you to do, or you don't have to, but I'm putting it out there, is I would like each of you to choose one word from one of these 4 categories. You can see there's so many that I want from each category. I want you to type in that word, and I want the word that you choose is going to be one of the words that I could use on the exam. And so as you can see here, I've already claimed a couple things that I'm going to put on the exam, whether you choose them or not, and that is anything that ends in PNEA, apnea basically, that is fair game. Also, as I said, the volumes and capacities are fair game. But the rest here, you can see I'm looking for 35 other pathology words, 10 diagnostic procedures, 10 therapeutic procedures, and 3 pharmacology. And I want you to choose this. Now, you could go in and choose the easiest ones that are in there, which I wouldn't be surprised if many of you do, and that's fine. But please understand that I reserve the right to modify this at any time, okay? So I would say pick a word that you want to remember. You want to remember what this procedure is because it's in your line of work, or your grandma had it done, or you just think it's cool. Pick it, come in here, type in your procedure or type in your pathology, and then put your name like that. Now, your formatting, you're going to mess up my formatting, so make sure you fix it once you do that. Everybody who does this before Friday at noon will get 1 point extra credit. So get onto Canvas and find the Google Doc. It will be in the modules section. Input your words by noon on Friday, the 18th, which is tomorrow. And if you don't put the words in, I'm going to fill up the list. So be warned if you don't. You get extra credit if you do, though, so it's always good incentive. And use this list to study from, plus make sure you're studying all the combining forms, prefixes, and suffixes, everything that ends in PNEA or apnea, and the volumes and capacities. Any questions? Let me know. Have a wonderful weekend.